chapter 28 is a hugely interesting chapter about the prefrontal and anterior temporal lobes involving behavior, emotions, decision-making, and personality. We're sort of going to gloss over this information, mostly because it's good to know, but it's not really in our wheelhouse for physical therapy. One thing we're going to talk about is emotional lability, because that's something that you might encounter in the clinic. I mean, you might encounter a lot of these different things. And then we're going to talk specifically about traumatic brain injury, which often affects the prefrontal and anterior temporal lobes. So I want you to be able to list the signs and symptoms of mild traumatic brain injury or moderate to severe traumatic brain injury, and to be able to define emotional lability. So the cerebral cortex has a lot of association area in the frontal cortex. So cerebral cortex areas that are not directly involved with sensation or movement are considered association areas. And the prefrontal cortex is divided into 3 areas named for their anatomic location. Lateral prefrontal association cortex, medial prefrontal association cortex, and ventral prefrontal and anterior temporal association cortex. Do you need to remember those? No, you don't. I'm just letting you know about this. So just know that a huge amount of the frontal cortex is association cortex. The only part that's not is those motor planning areas and the primary motor cortex. And then a little bit on the temporal lobe as well. So goal-directed behavior is considered executive function, and it includes being able to decide on a goal, planning how to accomplish the goal, executing a plan, and monitoring the execution of the plan. So if you don't have goal-directed behavior, you are unable to function at the highest cognitive levels. So normal adults have goal-directed behavior. Children don't, because their prefrontal cortex isn't developed yet. And people with dementia may not, because that part of their brain may have deteriorated. And a lot of people with brain injuries have trouble with goal-directed behavior as well. So there's a lot in the book about loops, and we're not going to talk too much about them, but I'm just going to hit on them a little bit just as a matter of interest. So the function of the lateral prefrontal cortex is goal-directed behavior, and that includes working memory, judgment, planning, abstract reasoning, divided attention, and sequencing activity. Divergent thinking is the ability to conceive of a variety of possibilities, and that's what happens in the lateral prefrontal cortex. So there's not just a single outcome that you can sort of think of a variety of possibilities for the outcomes of your actions. So people who have lateral prefrontal cortex lesions are unable to set goals, plan, execute a plan, or monitor the execution of a plan. So you can see how that would interfere with day-to-day activities. Lesions in the lateral prefrontal cortex have little effect on intelligence, but despite the ability to perform normally on conventional intelligence tests, people with prefrontal lesions function poorly in daily life because they lack goal direction, and they also lack behavioral flexibility. So that makes it really difficult. So emotion is considered a short-term subjective experience, like something that you just like. Somebody blocked off your car and you're pissed off for a minute, you're angry. Short term, you get over it. That's emotion. Mood is a sustained, subjective, ongoing emotional experience. So you've had those days when you're just in a bad mood, like everything's ticking you off. Not just the car that blocked your way, but everything else, everything and everybody. That's more mood. I don't know, I'm just coming up with these examples off the top of my head. Emotions color our perceptions and influence our actions. It's basically the non-conscious evaluation of a situation, our emotional response to something. And being able to control your emotions is part of that executive functioning. The medial prefrontal association cortex is involved in emotion, self-awareness, and motivation. It identifies emotional stimuli and generates and perceives emotions. It also helps you perceive others' emotions and makes assumptions about what other people believe in their intentions. So that's interesting. There's that social aspect to it. So people who have lesions in the medial prefrontal association cortex have apathy and lack of emotions and insight. People report to feeling very flat, like not feeling any emotions. And it impairs the understanding of other people's emotions, beliefs, and intentions as well. So people with medial prefrontal association cortex lesions can have paranoia and feel like they're being attacked because it impairs their understanding of other people's and their interpretation of other people's emotions. So we have a group of structures in our brain that are involved in recognizing emotional stimuli and generating and perceiving emotions. This is a list of them. You don't need to know that. You don't need to know the list, but just know that it's not any one area. It's a whole group of areas that's doing it. We have a loop, a neural loop, the emotion loop, which links emotion, cognitive, and motor symptoms. And it's involved in reward-seeking behavior, concerned with finding pleasure or avoiding unpleasant things. So there are multiple areas of the brain, as we said, which attempt to control which emotions are experienced and how emotions are experienced and expressed. Voluntary regulation of emotions occurs when a person consciously decides to control his or her emotions. So you're just saying, I'm not going to let this bother me, or whatever. You're going to control your emotions. Loss of normal regulation of emotions causes emotional lability, and this can be a result of a lesion or other problem. And so people have emotional swings with emotional lability. So basically, emotional lability is considered uncontrolled expression of emotions. There are three aspects of it. One of them is abrupt mood shifts. One is involuntary and or inappropriate emotional expression in the absence of subjective emotion. So that's just bursting into tears for no reason or bursting into laughter for no reason. Emotion is triggered by non-specific stimuli unrelated to the emotional expression in the case of emotional lability. So you burst out crying for no reason or you burst into laughter for no reason. That's why it's abnormal, because it's uncontrolled expression of emotion, and there's not necessarily a stimulus that's causing it. Motivation is centered in the medial prefrontal cortex and the ventral striatum, just to say where it is. Ventral striatum activity is essential for increasing frequency of rewarded behaviors. So remember in the study skills section of your life with me, where I talked about when you do your, like if you're doing the Pomodoro technique, at the end of your Pomodoro you want to reward yourself with some rest. So then you increase the frequency of rewarded behaviors, motivates you to study more. This is where it happens, in the prefrontal cortex. So with ventral prefrontal cortex lesions, making good decisions depends on a balance between emotional, impulsive, and it's immediate system centered in the amygdala and the lateral prefrontal rational cortex. So people with lesions in the prefrontal cortex have intact intellectual abilities but use poor judgment, are impulsive, and have difficulty conforming to social conventions. So a lot of times you'll meet somebody who maybe meets that category, and when you're talking to them, you'll find out that they had a brain injury early in life. They have poor judgment, they're impulsive, and they have difficulty conforming to social conventions. In lesions that affect the somatic marker circuitry, poor judgment and defective social intelligence cause severe problems in social function, employment, interpersonal relationships, and social status. So brain injuries can really affect the quality of someone's life. Social intelligence is different from intellectual intelligence, and it depends on the integration of emotion from structures that process emotions with analytic information, whereas goal-directed behavior requires the lateral prefrontal cortex and the parietal cortex. So social intelligence is important in conforming to social conventions and like fitting in, being able to function in a workplace with other people. People with prefrontal cortex lesions often can't do that. With traumatic brain injuries, in approximately 80% of cases, TBIs are considered mild, and the common name for a mild TBA is a concussion. So concussion is a traumatic brain injury. It's just a mild traumatic brain injury. Most moderate to severe traumatic brain injuries occur in motor vehicle accidents. Severe traumatic brain injury causes approximately 10% loss of brain volume in the first year after the injury, and white matter loss continues for up to 8 years after the injury. People with severe traumatic brain injury show poor judgment, decreased goal-directed behavior, memory deficits, slow information processing, attentional disorders, and poor divergent thinking. I have found people with traumatic brain injuries to be some of the most difficult patients to work with. However, they can make good progress, and it is rewarding to work with them. The majority of moderate to severe TBI injuries occur in motor vehicle accidents because the impact tends to damage the orbitofrontal, anterior, and inferior temporal regions and cause diffuse axonal injury. So that's why it has those behavioral and cognitive effects. Traumatic brain damage in infants is most frequently attributable to accidental falls, but brain damage consequent to most falls is relatively minor because babies are small, and when they fall, there's not as much impact. More severe brain injury usually requires greater force than a typical fall that a baby can take, and forces that are generated sometimes when an infant is violently shaken. So trauma from shaking is due to the impact of the brain striking the skull repeatedly. So there's actually a disorder they call shaken baby syndrome, and it's a traumatic brain injury. So don't shake the baby. That's the takeaway on that.